Thank you, Madam Chairman, members. I'm here to talk to you about something a little different than what you've been hearing all day long. Although it is the other side of this. Earlier this morning, Mr. Roberts asked a couple of the witnesses about what happened if various programs, who covered the cost of various programs were not covered, and the response was the taxpayers. I'm here to tell you a little bit about what that looks like for a couple of the major programs that this committee has oversight over. As you know, hospitals in Texas provide a substantial amount of the care for low-income and uninsured people in Texas, and they're not compensated for all of that care. A substantial portion of the uncompensated care is covered by two programs, the disproportionate share program and the unemployment or the uncompensated care pool that's provided under the Medicare waiver. Both of those things are scheduled to decline substantially going forward. I was asked to take a look at those two programs and see what would happen if those federal funds went away as they're expected to do. The reason that I was asked to do that is that my background is in taxation and not in health care. I've studied the state's tax system and particularly their property tax system for almost 40 years now. If you look at the programs that where this federal money is going to go away, and it's about $1.3 billion in the first year that they would go away. These are for services that are provided by local hospital districts that are in general not optional. If the person shows up at the hospital, the service has to be provided and someone ultimately has to pay for it. The primary source of revenue for the hospitals that provide these services are local property taxes that are put up as the governmental share, the intergovernmental transfer, the IGT, that draws down the federal money. What the report that you got before you shows you are estimates of what would happen if this money goes away. Yes, ma'am. It's called very delightfully Rocks in the Water. It provides estimates of the impact on local hospitals and the difficulty that they would have doing it. Altogether, there are 165 taxing jurisdictions that committed funds for IGTs under the two programs that are estimated. 107 out of the 147 hospital districts in the state would lose about about $740 million in federal funds under those two programs. Nearly 31% of the total amount of local maintenance and operation property taxes that those hospital districts levied in 2015. 91 of the districts would exceed the rollback rate if they had to replace the revenue, and 2 of the districts couldn't do it because their statutory tax limitation would be exceeded. 54 counties are in the same boat. They would lose about $170 million. 25 counties would exceed the rollbacks, and 4 of the counties would exceed their constitutional limitation of 80-cent M&O rate in order to replace this revenue. The 6 largest hospital districts in the state that provide all of the match money for the private hospitals in the state under the DISPRO program would lose a total of about $600 million. All of them would exceed their rollback rates. What's all it mean? What it means is extension of the 1115 waiver or something like it, or some legislatively addressing the uncompensated care component of hospital services to low-income Texans has to take place. Failure to provide that uncompensated care through actions is equivalent, inaction is equivalent to raising the local property tax. And that's the way it is. The clock is ticking, the extension, the waiver expires at the end of the year.
It's ticked up here as well, sir.
And all of those local jurisdictions have to set their budgets by about the end of September.
I don't think that anyone on this committee underestimates the importance of the 1115 waiver and understands how that is actually going to impact. Did you register on behalf of yourself or anyone of this organization? Okay.
Texas
when you
Impact.
Introduced yourself, I didn't catch that.
Oh, I'm sorry. I was here on behalf of Texas Impact, which is one of the organizations
Great.
that required the study.